Hi everyone and welcome to this webinar from the Women in Clinical Engineering webinar series. I'm Ghina Safi from Lebanon and I recently earned my Master of Science degree in Biomedical Engineering from the American University of Beirut. Degel?
My name is Degel. I'm Nigerian by origin, but currently studying for my master's degree in bioinstrumentation and medical imaging at the Addis Ababa University, Ethiopia.
Degel and I were the IFMBE CED Fall 2020 interns, and today we're going to share with you some of the lessons we learned during our exposure to the global clinical engineering. Also, we're going to share with you some of the challenges that young CE women are currently facing. So firstly, during our internship, not only we learned some of the best practices in health technology, but also we learned where and how we can find the best freely available resource, which we can use in our education and later in our practice. And this is very important, especially in countries with limited resources, because it allows individuals themselves to go seek the information they need to provide best patient's outcome, regardless if the authorities in these countries are providing such kind of information or not. Another lesson is the importance of supporting our peers both in local and international level. And during our internship and all the meetings we attended, we were really impressed by the passion everyone showed towards their work and also the time and effort they were willing to put to collect resources related to COVID or other ongoing issues to then freely disseminate them to everyone in this community and beyond. Third point is the importance of staying humble, which is a very crucial attitude regardless of the person's status and position. Also to learn how to accept criticism from others and to be willing to correct ourselves accordingly, because being arrogant will push people away from us and will destroy any chance of a constructive discussion. And the moment someone feels that he is the best in the room and he's not willing to listen to others because they are below him, he should take a time out and rethink his behavior, because the ultimate goal in science or in any other field is to help others and to provide value for them. And this is not someone's goal, then he's doing something wrong. The most important point, in my opinion, is to ensure and stand for diversity, inclusion, and equity and everywhere. In educational institutions, health institutions, everyone should feel accepted, respected, and understood, regardless of their background, ethnicity, or gender, because only in a safe and inclusive, welcoming environment where we treat everyone's experiences as being equally important, we will be able to share and exchange knowledge and constructive discussions. And we should always remember that each one of us is special, unique, and is an added value to the entire community. Unfortunately, this is not an easy thing to achieve. As a young woman living in a country like Lebanon, we still have many obstacles to overcome and so many fights to do to get our rights. For we still, until today, face gender-based discrimination and judgment based on appearance. For instance, as a hijabi woman, we are not allowed to work in some health institution, and I do find this ridiculous. And countries with such mentality will not be able to progress, because the only way to improve is when everyone are working together, supporting and encouraging their peers. Thank you for listening, and to you, Dujel.
Thank you, Gina. We also had the opportunity to meet clinical engineers in the world by participating in BNC collaborators meeting and other projects. It has been very interesting to see what other clinical engineers are doing to improve healthcare in their countries, share information, ideas, and advice on how to move clinical engineering forward and improve patient healthcare. One of the lessons learned here is collaboration and teamwork skills with an international body of technical and professional background. And we also got to participate in ongoing and new projects between the IFMBC, the GCA, and WHO. We were involved in following up on the mentorship program by the IFMBCD, which is to start this year, and also ongoing projects for low middle income countries by WHO and GC, and then other tasks as assigned. We found this very interesting and very educative. We'll go on to share with you challenges that young CE women face. One of it is lack of clinical engineering educational program and training opportunities in most low middle income countries. I would like to highlight that job opportunities are few, And in low middle income countries, the clinical engineering field is relatively new. So as such, there are no real training opportunities for your or educational programs for young clinical engineers, and this is a big problem. The second point, which says race and gender discrimination in job and then internship opportunities. As Gina was giving an example earlier, in some health institutions where women with hijab are not allowed to work, this is wrong and needs to be corrected. Also, it's also easier for the males to get jobs, clinical engineering jobs, than females in most countries. We find this very challenging. And then we see that there are not enough females in the field. So not enough females are going into clinical engineering programs. It's almost seen as a male field. And I think this idea needs to be corrected. Um, so that young women need to be encouraged to pursue this career, and we need to do this by creating opportunities for them and encouraging them. Thank you very much.
Thank you everyone for attending and listening to this webinar. If you have any question, don't hesitate to contact me or Degel, and happy International Women's Day for everyone.
Happy International Women's Day, everyone.